Knee osteoarthritis is a degenerative joint disease that affects millions of people worldwide. This progressive condition affects the knee joint, which is one of the most essential joints for mobility and daily activities. Osteoarthritis affects over 500 million people globally, making it the most common joint disorder and a leading cause of disability in older adults. Osteoarthritis involves the breakdown of cartilage, the smooth tissue that cushions the ends of bones where they meet to form a joint. As the disease progresses, cartilage deteriorates, bones may develop spurs, and the joint space narrows, causing inflammation and pain. People with knee osteoarthritis typically experience several symptoms that impact their quality of life. Pain is the most common symptom, especially during or after movement. Joint stiffness is often noticeable after periods of inactivity or in the morning. As the condition progresses, patients experience reduced mobility, making everyday activities challenging. Many patients also experience joint swelling and inflammation, particularly after activity. While there is currently no cure for knee osteoarthritis, various treatments exist to manage symptoms and improve quality of life. Treatment goals include reducing pain and inflammation, improving joint function and mobility, slowing disease progression, and enhancing quality of life. In the upcoming sections, we'll explore a research study comparing 3 promising treatments for mild to moderate knee osteoarthritis. These include platelet-rich plasma, PRP, hyaluronic acid, HA, and a combined therapy approach using both treatments together. For knee osteoarthritis, 3 main treatments are being compared in this study. Hyaluronic acid, or HA, is a gel-like substance naturally found in joint fluid. It provides lubrication and acts as a shock absorber. In osteoarthritis, the amount and quality of HA decreases. HA injections supplement this loss to improve joint function and reduce pain. The benefits of HA include improved joint lubrication, reduced friction between joint surfaces, and enhanced shock absorption. The effects may last from 6 to 12 months. Platelet-rich plasma, or PRP, is created from the patient's own blood. It contains concentrated platelets with growth factors that may promote healing. After concentrating the platelets through centrifugation, the resulting PRP is injected into the osteoarthritic knee. The growth factors may help reduce inflammation and stimulate cartilage repair. The third treatment option combines hyaluronic acid and platelet-rich plasma, seeking to leverage the benefits of both approaches. This combination therapy provides both the lubricating properties of HA and the regenerative potential of growth factors from PRP. Researchers believe the combination may create synergistic effects, where HA enhances the retention of growth factors, potentially leading to prolonged therapeutic benefits and complementary mechanisms of action. To summarize, we've examined 3 treatment options for knee osteoarthritis: hyaluronic acid, platelet-rich plasma, and their combination. Each approach offers distinct mechanisms of action while sharing the same delivery method of intra-articular injection. The study aims to determine which treatment provides optimal outcomes for patients with knee osteoarthritis. This study used a randomized controlled trial design to evaluate different treatments for knee osteoarthritis. The 105 participants were randomly assigned to 3 equal groups of 35 patients each. The first group received hyaluronic acid injections, commonly known as HA. The second group received platelet-rich plasma, or PRP, injections. And the third group received a combination of both HA and PRP treatments. Each patient received 3 injections of their assigned treatment. The first injection was administered at the beginning of the study, followed by the second injection after 2 weeks. The third and final injection was given 4 weeks after the start of treatment. Patient outcomes were measured at multiple time points throughout the study. Measurements were taken at baseline before any treatment, and then at 1, 3, 6, and 12 months after the initial treatment. The study used 2 standardized assessment tools to measure outcomes. The WOMAC questionnaire assessed pain, stiffness, and physical function. The VAS scale measured pain intensity on a continuous scale. In summary, this well-designed study followed 105 patients for a full year, to evaluate the effectiveness of different injection treatments for knee osteoarthritis. Now let's examine the pain reduction results when comparing PRP to hyaluronic acid treatments. This graph shows pain scores over time on a scale from 0 to 10, where higher scores indicate worse pain. Both treatments are injected into the knee joint space to help reduce pain in osteoarthritis patients. The orange line represents patients who received hyaluronic acid injections. While they experienced some pain relief, their improvement plateaued after 6 months. In contrast, the green line shows patients who received platelet-rich plasma injections. These patients demonstrated significantly better pain reduction at all follow-up points. The difference between treatments was most pronounced at the 6 and 12-month follow-ups, suggesting PRP provides more durable pain relief. The data clearly shows that PRP provided superior pain reduction compared to hyaluronic acid at all measured time points. This difference became even more notable at the later follow-up visits, with PRP maintaining its effectiveness at 6 and 12 months. These results suggest that PRP injections may provide more effective and longer-lasting pain relief than hyaluronic acid alone for knee osteoarthritis patients. Physical function outcomes are a critical component when evaluating knee osteoarthritis treatments. Our data shows substantial differences between PRP and hyaluronic acid injections. Let's examine the percentage improvement in physical function over time. This graph tracks patients' progress over a 12-month period. At the 12-month mark, PRP treatments showed a 45% improvement in physical function, while HA treatments achieved only a 25% improvement. This 20% difference is statistically significant and clinically meaningful. Let's translate these clinical improvements into real-world benefits. What does a 20% better physical function actually mean for patients? Patients receiving PRP treatment typically experience greater improvements in everyday activities. Walking becomes easier, with patients able to walk longer distances with less pain and fatigue. Climbing stairs, one of the most challenging activities for knee osteoarthritis patients, becomes less difficult. Patients report increased stability and confidence. Standing up from a seated position requires less effort and causes less knee strain. This simple movement, which many of us take for granted, becomes significantly easier. These functional improvements translate to a significantly better quality of life. Let's see how the knee's mobility improves over time. Beyond mobility, patients receiving PRP report additional quality of life benefits. These include reduced dependence on pain medication, the ability to return to light recreational activities, improved sleep quality, and greater independence in daily tasks. In summary, PRP treatment offers superior improvements in physical function compared to HA injections, with the benefits becoming most pronounced at the 12-month mark. These improvements translate to meaningful enhancements in daily activities and overall quality of life. In this section, we'll examine the effectiveness of combining hyaluronic acid HA with platelet-rich plasma PRP compared to using HA alone for treating knee osteoarthritis. Both treatments are injected into the knee joint space. The study measured outcomes over a 1-year period, focusing on pain reduction, functional improvement, and overall patient satisfaction. The results show significant differences in pain reduction between the two treatments. At baseline, patients reported an average pain score of 7.8 on the visual analog scale. After 1 year, patients treated with HA alone showed improvement to an average score of 4.2. However, patients who received the combined HA plus PRP therapy showed substantially better outcomes, with average pain scores dropping to 2.1. This represents a 73% reduction from baseline for the combined therapy, compared to just 46% for HA alone. The functional outcomes show a similar pattern of improvement. On the WOMAC scale, where lower scores indicate better function, both treatment groups started with a baseline score of around 68. Over the course of 1 year, patients treated with HA alone showed gradual improvement, reaching a final WOMAC score of 45, representing a 34% improvement in function. In contrast, the combined HA plus PRP therapy group demonstrated significantly better functional recovery, with WOMAC scores improving to 25 at the 1-year mark, a remarkable 63% improvement from baseline. The key findings from this comparison clearly demonstrate the advantages of combining HA with PRP therapy. For functional improvement, the combined therapy showed a 63% improvement in WOMAC scores compared to just 34% with HA alone. This represents a 29% advantage in functional recovery for patients receiving the combined treatment. Perhaps most importantly, the benefits of combined therapy were sustained throughout the entire 12-month follow-up period, whereas the HA-only group showed a plateau in improvement after 6 months. This suggests that adding PRP to HA treatments provides better long-term results than using HA by itself. Based on these findings, the clinical recommendation is clear. Combining HA with PRP appears to provide superior and more sustained pain relief and functional improvement compared to HA alone for patients with knee osteoarthritis. Now we'll compare the effectiveness of combined hyaluronic acid plus PRP therapy versus PRP treatment alone. The research data shows that combined HA plus PRP treatment significantly increased physical function at both 1 and 3 months compared to PRP treatment alone. When we look at the data on functional improvement scores, we can see that while PRP treatment showed effectiveness, adding hyaluronic acid enhanced early functional improvements at both the 1 and 3-month assessments. This suggests potential synergistic effects between the two treatments. Hyaluronic acid may enhance the scaffold function for platelets, while PRP provides growth factors that promote tissue repair. In summary, while both treatments are effective for knee osteoarthritis, the combination of HA plus PRP appears to provide superior early functional outcomes compared to PRP alone. The timing of benefits varies significantly between the 3 treatment approaches for knee osteoarthritis. To understand these differences, let's visualize how each treatment performs over the 12-month study period. When examining short-term benefits, the combined HA plus PRP therapy shows significantly better functional outcomes within the first 30 days compared to either treatment alone. This makes the combined approach potentially ideal for patients seeking faster relief. Let's now look at the longer-term outcomes. In contrast, when we look at longer-term benefits, PRP treatment maintains its effectiveness throughout the 12-month study period. While the combined therapy shows early advantages, PRP demonstrates more sustained long-term benefits for patients. These timing differences are important considerations for treatment selection. Let's summarize the key findings regarding when each treatment performs best. Understanding the timing of benefits allows clinicians to select the most appropriate treatment based on patient needs for either rapid relief or long-term symptom management. The findings from these studies have important implications for patients with knee osteoarthritis. To understand how different treatments work, let's first look at the knee structure affected by osteoarthritis. The key findings show that PRP provides effective long-term pain relief, while the combination of HA plus PRP offers quicker functional improvement. When considering treatments, several patient-specific factors should guide the decision-making process. A structured decision framework can help guide treatment selection based on patient needs. Based on these findings, we can offer individualized treatment recommendations for different patient groups. Ultimately, treatment choices should involve a discussion between patients and their healthcare providers to determine the most appropriate option based on individual circumstances. While examining the results of this study, it's important to acknowledge several limitations. The study was limited by its single-center design and moderate sample size, which may affect generalizability. Additionally, the follow-up duration was limited to 12 months, which may not capture long-term outcomes. No placebo control group was included, and there was some heterogeneity in osteoarthritis severity among participants. Despite these limitations, it's important to note that this was a well-designed, randomized controlled trial providing valuable clinical insights. Looking ahead, Several important areas for future research have emerged. Larger multi-center studies with longer follow-up periods would significantly strengthen the evidence base. There's also a need to determine optimal injection frequency and timing protocols. Identifying which patients benefit most from each treatment approach remains a critical question. This includes developing personalized treatment protocols based on individual factors. Cost-effectiveness analyses comparing these injection therapies to traditional treatments would provide valuable information for healthcare systems. Additionally, further investigation into the biological mechanisms of combined therapies could lead to improved formulations. In conclusion, while this research provides important evidence for treatment decisions, it represents just one part of our evolving understanding of knee osteoarthritis management.